Hi, for those who do not know me, I am Dr. Dinesh Sharma. By profession, I am a maxillofacial surgeon. It's a specialty which is done after your graduation in dental surgery. In front of me is my most favorite snacks. It's one of the chart items, pani puri, which I relish the most. If you have to eat pani puri, there is a method. You can't just bite the puri because you have some stuff inside it, some liquid stuff which will flow out. So the only way that you can eat pani puri is you have to open your mouth wide. Wow, excellent. One of my most favorite items. So you need to open your mouth wide to completely stuff the material into the mouth and then enjoy it. And some places it is also known as GOLGAPPA. It's one of the most favorite chart item for most of the youngsters in our country. It is also one of the most popular street food. My next favorite snack is, in Hindi we call it chakli, which is made of rice, and in Telugu we call it murkulu. This is another favorite item of mine. Little crispy and little hard to eat. Yeah, very nice. So these are my two favorite items. Likewise, there are many items, many snack items, and chart items which we can enjoy only if we are able to chew them properly, if you are able to open your mouth properly. Imagine if this pani puri is there in front of you and you also like it more than any other, and if you have to eat it and if you have to open your mouth and ah, I can't open my mouth, I can't enjoy this. Yes, and similarly, this chakli, if you have to eat and if you bite and you get a pain, then what do? So this is a very sad situation for many. Yes, there are some conditions where you have a difficulty in opening your mouth, or there are conditions where you have difficulty while chewing the food, not because you have a problem in the teeth, but because you have a problem in these two joints. Now I'm going to talk about these two joints. In normal layman terminology, we can call them joints of the jaw, but in medical terminology, we call them temporomandibular joint, which are two, one on the right side and one on the left side. One thing is very peculiar about this joint is, these two joints are the only joints in this body which cannot move individually. If one joint has to move, the other joint has to move. You cannot move one joint and not move the other joint. Another peculiar thing about this joint is there are two type of movements in this joint. One is a rotation and one is a sliding movement. And unless these two movements happen, you cannot open your mouth wide. Just for your sake of it, you to understand, to have a better understanding, this is how this joint works. It moves forward, it moves backward, it moves forward, it moves. The initial opening is rotation, and the remaining opening can happen only if there is a translatory movement of this joint. So this is how this joint moves. Now I was telling you there are some conditions where you have a difficulty in opening the mouth because of some problems in this joint. Yes, there are many problems associated with this joint, but right now I am not going to discuss all the problems. I am going to discuss only that problem which causes pain while opening the mouth or which causes difficulty while chewing your food. This is a problem which is very common among the people. In fact, Every second or third day, I get a patient with this problem. They say they are not able to open the mouth, or they say they have difficulty in chewing the food. When they are chewing the food, they get pain in front of their ear in the joint. This problem usually happens because of some problem with the disc which is placed in the joint. I am not going to go into details of how the joint looks, but for your understanding, I would say this disc, which is normally positioned in between the upper and the lower joint, has some problem and it gets displaced from its normal position. And this displacement of the disc causes difficulty in opening the mouth and causes pain when you are opening the mouth, and sometimes also while chewing your food. Now, what are the reasons or what are the causes for such a problem to occur? The most common reason that I see in my clinic is patients have some kind of a peculiar habit of eating only on one side. They chew only from one side of the teeth. Reasons could be anything. Some patients develop that habit because they have some problem with the teeth on one side. So instead of consulting a doctor, they conveniently avoid eating on that side and start eating on the other side. And over a period of time, it becomes their habit, and subconsciously also, they start eating only on one side. When you have a chewing pattern like this, where you eat only on one side, the forces that fall on the joints are not balanced. And because of this, one of the joint, usually the opposite side joint, gets affected because there is more wear and tear of that joint. Second reason that we normally see is some patients have a very severe closed bite. When I say closed bite, it means the patient, when they close their mouth, there is over closure than normal. If you want to know what over closure is, when you close your mouth, normally there is an overlap between your upper and lower front teeth. It's usually that overlap is 2 millimeters, but in these patients, this overlap is more than 6 millimeters or 5 millimeters, 5 to 6 millimeters. So when there is an overclosure, the stresses on this joint is more. Yes, this condition is there from the childhood, and by the time they attain the age of 19, 20, they develop problems with this joint. They say they have a problem in the joint, they are not able to eat or they are not able to open their mouth wide completely. So, this is another condition. Third is, some patients have a habit of grinding their teeth in the night while they are asleep, or they have a habit of clenching their jaws or teeth together, maybe because of stress. So this joint problem is also very common among the patients who take a lot of stress or who get stressed out for small things. And these are the patients again who have this problem. And again, it's very common to see this problem among patients who have a very small lower jaw. It's in such patients, they have two problems because of the small lower jaw. They have to, whenever they have to bite anything with their front teeth, they have to move their lower jaw forward more than normal to bring the lower front teeth in level with the upper front teeth. And this excessive movement of the jaw every time when they bite, there is more wear and tear in the joint, and that causes this problem. These patients are also potential patients to develop sleep apnea, that is difficulty in breathing when they are sleeping. So this small lower jaw is another reason for such problem to develop. So if you enumerate, these are the most common things that we come across, the common causes or the reasons that we come across with this joint problem. Of course, in some cases, we really can't pinpoint any one cause for that problem. But for your understanding, I have to tell you that this problem is very common among the people. And how do you identify this problem? In the initial stages, when the problem begins inside the jaw, inside the joint, that is when the problem with the disc begins inside the joint, in the beginning stages there is no pain. They usually hear some clicking sounds in front of their ear when they are opening their mouth or when they are chewing their food. Apart from this, normally they don't have any other problem. They just hear some clicking sounds here when they are eating food or when they are opening their mouth. And because it is usually not associated with pain, patients tend to ignore it at this stage. They don't seek the opinion of any doctor. And then this condition progresses further, wherein the disc, as I said, slowly loses its attachment and gets displaced in the front of the joint. And it is this time when the patient has difficulty in opening the mouth and also has pain when he is opening the mouth, because the disc becomes an obstruction for the sliding movement of the joint. As I said, the joint has two movements. One is rotation and another one is sliding. Rotation will help you to open your mouth maybe 2 centimeters to 3 centimeters, but the remaining mouth opening can happen only if you have the complete sliding movement, and this disc displacement prevents the sliding movement of the joint and they have a difficulty in opening the mouth. Other conditions are normal wear and tear. Some people, because of their eating habits, they also develop this problem. Then it's a normal wear and tear, as we see with the knee joints. Similarly, in this joint also normal wear and tear. At the age of 45, 50, 55, they develop this problem, and we normally call it osteoarthritis. Other conditions are rheumatoid arthritis, where all the joints are usually affected. Most of the joints are affected, and this being one of them. The treatment for this joint is actually very simple, not a treatment to fear about. If you meet a doctor in the initial stages, as I said, when you have a clicking sounds, the doctor can help you by, a maxillofacial surgeon can help you by giving you a splint, which is normally you have to wear it overnight. When you are asleep, you have to put it on your teeth and sleep, and this splint is called the temporomandibular joint splint or TM joint splint. And usually with this, if you wear it for 4 to 5 months or 6 months, you have benefits out of this. But if you come little late, splint therapy may not be sufficient. You may have to get some other treatments done. Sometimes a simple injection into the joint space can relieve the pain, but sometimes we have to go for an additional procedure wherein we put 2 small needles into the joint and clean the joint. This procedure is called arthrocentesis. It is done under local anesthesia and patient doesn't have any pain, and usually 90% of the patients with this problem benefit with this procedure. Very rarely, 4 to 5% of the cases are so severe that none of these simple procedures help the patient. And then in such cases, based on the MRI findings, based on the CT scan findings, we will be able to tell the patient whether they need to go for surgery. Very few patients require surgery, but 90% of the patients do not require surgery, and a simple procedures like a small injection to the joint or joint lavage with the 2 needles or split therapy or a combination of all these procedures can give benefit or can help the patients. So my dear friends, today I have talked to you about the joint problems, which is very common in us. Every third person usually has some joint issues. So do not ignore it. If you see that there is some kind of noise or clicking that you can hear when you are eating your food or yawning or opening the mouth, consult your oral and maxillofacial surgeon, and you can benefit from the treatment. Bye.